As concerns grow about the serious shortage of children's Tylenol in this country, Health Canada has taken what it calls an exceptional step by waiving certain labeling rules in order to import pain relievers from the US and Australia. But some pharmacists are questioning why this is still happening, and they say much more needs to be done to address the problem heading into respiratory illness season. Forced to make the liquid form of children's pain reliever from raw ingredients because it's been 4 months since this Beaches pharmacy in Toronto has received a shipment of children's Tylenol or Advil. Kiro Mase says it's been hard to witness as desperate parents come in or call every 15 minutes looking for the product.
It's extremely heartbreaking when I have a parent and I could hear the child screaming in the background over the phone. It tears my heart apart.
It's a problem he can't quite understand, as our neighbors to the south aren't experiencing the same shortages.
This is available everywhere in the world. Why is it not available in Canada? It's a mystery. We need some honesty. We need some answers.
The Ontario Pharmacists Association tells us there was an unprecedented 300% increase in demand when the cold and flu season started earlier than expected.
So the manufacturers, they forecast based on annual consumption rates, and this really took us all by surprise.
While they have ramped up production by 34%, which I'm told is a record level, there's a limit to what Canada's manufacturers can do.
We do have limited domestic capacity in general in Canada in terms of factories that produce these things. We have heavy dependency on foreign countries to source the active product ingredients and to produce it.
This is a full admission to the fact that you are inadequate at manufacturing and providing for your own citizens. That in of itself is extremely problematic in my opinion.
Health Canada is now waiving bilingual labeling rules to import ibuprofen from the US and acetaminophen from Australia to be distributed to hospitals across the country. They say measures are in place so that hospitals receiving the products have the necessary labeling information available in both languages. But the products won't be distributed to community pharmacies yet because of those same labeling requirements.
I don't think anyone in Canada, Quebec included, would be opposed to bypassing the rules for the labeling if it means that we're going to have liquid formulations for our kids. Right. This is absolutely ridiculous.
I don't think we have a choice. We're in an urgent situation. There's a solution there. It's a short-term measure, but I think the government should be acting with urgency to bring up those products into the Canadian market.
Health Canada is looking at all options. They say they are working closely on additional proposals to make those products available to community pharmacies and consumers. For City News, I'm Tina Yazdani.